Hello, my name is Michael Gillard. All right, so the first concept I'm going to talk about is disease. So, disease is basically an acute or chronic illness that is acquired through birth or through other means that is a disruption in the normal physiology. So, an example of this would be hypertension or high blood pressure, from normal blood pressure to high blood pressure. Next classification, or sorry, next concept is disease classification, which is basically the organization of diseases based on how the mechanisms of how they act or how they disrupt normal function. So, an example of this would be a metabolic classification for like type 2 diabetes. So, type 2 diabetes is a disease of the metabolic process in the body. So, next is etiology. So, etiology is the cause of disease. So, an example of this would be of a disease, which is basically like an example would be tuberculosis. So, tuberculosis is a disease that is caused by the tuberculosis bacteria. So, it's the bacteria causing the tuberculosis, the disease. Next is pathogenesis. So, it's basically the path of a disease, or the progression of a disease. So let's say you have cancer, and the progression of that would be anorexia and cachexia. So the path of that would progress to that. So next is symptoms. So symptoms is a subjective complaint. So let's say a patient came into an office and they said that I have pain. Let's say they have a pain of 8 out of 10. And so that's a subjective complaint that's not necessarily noted by an observer. And then next is sign. So a sign is something that is measured by an observer. So let's say a patient came in and they had one leg that was bigger than the other one, and the right leg was bigger than the left one. They say, oh, that right leg has swelling. That's a sign. So next is syndrome. So a syndrome is a collection of signs and symptoms that characterizes the state of characteristics of a disease. So let's say you have like fever, yeah, body aches and chills, and those are characteristics that classify the state of a syndrome, which is the flu. And so moving on from there is diagnosis. So a diagnosis is a designation of an adverse health problem. So like I said, say someone had a stroke, a physician to diagnose someone with a stroke. That's the designation. That is what that patient has that is affecting their health. It's what the patient has. So complications. So complications is any adverse effects from a treatment. So an example of this would be someone taking a atorvastatin to lower their cholesterol and it causes dizziness or something, or weight loss or something. That's an adverse effect of the treatment because the medication caused that symptom or sign. And prognosis. So prognosis is what the progression of a disease is like after a diagnosis. So a prognosis is someone with stage 4 cancer, pancreatic cancer that's spread throughout all over the body, metastasized, and there's no cure for it. Let's say that and their prognosis would be, oh, you have 5 months to live. So that would be a prognosis, is like what is expected after a diagnosis. And then last one is diagnostic test. So a diagnostic test is basically a test to help identify an illness or disease. So an example of this would be, let's say a physician wanted to understand more about someone's prostate, and they did a blood test. They draw some blood and they tested PSA in their blood. That would be an example of a diagnostic test to better identify a disease. So thank you so much. Have an amazing day.